Tuberculosis. Tuberculosis is a potentially serious infectious disease caused by the bacterium Mycobacterium tuberculosis. It mainly affects the lungs but can also affect other parts of the body. Spread of tuberculosis. Tuberculosis primarily spreads through the air when a person with active pulmonary TB releases bacteria into the environment. How TB spreads? Airborne transmission. When an infected person coughs, sneezes, speaks, or sings, tiny droplets containing Mycobacterium tuberculosis are released into the air. Inhalation. A healthy person may inhale this bacteria and become infected. TB does not spread through handshakes, sharing foods or drinks, kissing, or touching surfaces. High risk situations for TB spread. Close or prolonged contact with the person with active TB. Living in overcrowded or poorly vented spaces. Healthcare workers treating TB patients without protection. Weakened immune system, example HIV patients, malnourished individuals. Latent versus active TB. People with latent TB infection are not contagious. Only those with active TB disease in the lungs can spread the infection. Symptoms of tuberculosis. Symptoms can vary depending on whether TB affects the lungs, that is pulmonary TB, or other parts of the body, that is extrapulmonary TB. Pulmonary TB affecting the lungs. Persistent cough for more than 2 to 3 weeks, coughing up blood or sputum, mucus from the lungs, chest pain during breathing or coughing, fever often low grade, night sweats, fatigue or weakness, loss of appetite, unexplained. Weight loss. Extrapulmonary TB outside the lungs can affect lymph nodes, bones, joints, brain, kidneys, etc. Swollen lymph nodes, especially in the neck, bone or joint pain, example spine or hips. Abdominal pain if TB affects intestine or abdomen. Headache, vomiting, or confusion if TB affects the brain, TB meningitis. Blood in urine if kidneys are involved. Diagnosis of tuberculosis. Accurate and early diagnosis is essential to control the spread of TB and start treatment promptly. Medical history and physical examination. History of persistent cough, weight loss, fever, or contact with the TB patient. Physical examination of symptoms, example, lymph node swellings or chest sound. Diagnostic tests. Sputum test. Sputum smear microscopy detects acid fast bacilli AFB. Sputum culture. Gold standard grows Mycobacterium tuberculosis. It takes weeks. CBNNAT. Cartridge based nucleic acid amplification test. Rapid test that detects TB and rifampicin resistance. Chest X ray identifies lesions in the lungs suggestive of TB. Tuberculin skin test, Montauk's test. A small amount of tuberculin is injected under the skin to check for immune response. Interferon gamma release assays, blood tests that detect latent TB infection. Example, quantiferon TB gold. Biopsy or imaging. For extrapulmonary TB, biopsy or imaging like ultrasound, MRI, or CT scan may be required. Treatment of tuberculosis. Tuberculosis is curable with proper and complete treatment. The standard treatment involves a combination of antibiotics taken over a 6-month period. Standard treatment for drug sensitive TB. Intensive phase. For first 2 months, 4 drugs are given: isoniazid, rifampicin, pyrazinamide, ethambutol. Continuation phase. Next 4 months, 2 drugs are continued: isoniazid or rifampicin. This is known as HRZD regimen. DOTS strategy, direct observed treatment, short course. Under this strategy, a healthcare provider observes the patient taking their medication to ensure adherence. It improves treatment success rate and reduces drug resistance. Treatment of drug resistance TB, MDR TB or XDR TB. MDR TB resistance to at least isoniazid and rifampicin requires second line drugs like fluoroquinolones and injectable agents. Longer duration 18 to 24 months. Treatment is more complex with potential side effects. Supportive measures, nutritional support, counseling to improve adherence, monitoring for side effects, example liver toxicity or vision issues. Follow up, regular sputum tests, usually after 2, 4, and 6 months, chest x ray if needed, clinical monitoring to check for symptom resolution. Prevention of tuberculosis involves a combination of public health measures, personal protection, and medical strategies. Here's a concise overview. Vaccination, BCG vaccination, Bacillus calmette guerin, given to infants in countries with high TB prevalence. It helps protect against severe forms of TB in children like TB meningitis. Early detection and treatment, prompt diagnosis and complete treatment of active TB cases helps reduce the spread to others. Directly observed therapy DOT ensures patients complete their full course of treatment. Infection control, good ventilation in crowded places like hospitals, clinics, or homes. Use of masks, N95 respirators for healthcare workers or patients. Isolation of active TB patients until they are no longer infectious. Screening and preventive therapy. Screen high risk individuals, healthcare workers, people living with HIV or close contact of TB patients. Isoniazid preventive therapy IPT for latent TB in high risk individuals. Public awareness and education. Educate people about symptoms, persistent cough, weight loss, fever, night sweats. Encourage early medical consultations and adherence to treatment.